Okay, good afternoon, everyone. Um, Before we get started, we have a quick note for our Spanish-speaking viewers. Unfortunately, today, due to technical difficulties, we are not going to be able to offer a simulcast in Spanish, and we also do not have ASL interpreters with us available today. So we apologize for that. And Jose, do you want to let our Spanish-speaking viewers know about what's going on?
Definitely. Gracias por acompañarnos hoy para la actualización de la comunidad sobre COVID-19 con la doctora Sundari Mase. Pedimos disculpa que debido a dificultades técnicas no tendremos una transmisión en español hoy. Buscaremos subir esta actualización con subtítulos en español en nuestro canal de YouTube muy pronto. Muchas gracias. Back to you, Paul.
Thank you, Jose. Yeah, so I do want to remind everybody though that we will have this session will be posted on YouTube, and there will be translations available for that when that is posted later today. But thank you again. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID-19 update for Wednesday, November 4th. Again, we want to remind you, if you have questions today, please feel free to leave them in the comments area of the Facebook Live broadcast, or you can email them to us at publicaffairs@sonoma-county.org. That's public affairs, one word, at sonoma-county.org. And with that, let's go to Dr. Sundari Mase, Health Officer for the County of Sonoma.
Great, thanks so much, Paul. Hello, everybody. Thank you for joining us today. I want to go over our latest numbers first. Under the California's Blueprint for a Safer Economy, as you know, each county is assigned to a tier based on their local COVID-19 data. Based on this week's numbers, Sonoma County remains in the purple tier. Our new daily case rate per 100,000 is 11.1. This number must be lower than 7 to move to a less restrictive tier, unless we can lower our equity metric, which I'll discuss in a moment. Our county-wide testing positivity rate is 5.2%, well below the 8% that we need to progress to the red tier and almost to the orange tier. Our equity metric has come down. The testing positivity rate is 7.7%, which is still puts us in a less restrictive tier, but it's not to the point where we're in the orange tier yet. Though we do remain here, the county's enhanced COVID-19 strategies are already being rolled out. We have ramped up our testing to 300 to 350 tests per day in the first 2 weeks. The goal is to reach 500 tests a day with the objective of lowering the positivity and the equity metric rates, and also reaching the hardest hit communities and the vulnerable to find more cases of COVID, get them isolated, and get their contacts quarantined and evaluated. Though some might consider this discouraging news that we're still in purple, we welcome it since it's the only way to locate, isolate, care for infected people as we ramp up our measures towards finding cases. And this will lead us in the right direction in terms of controlling COVID. Recent events have opened up discussions about testing and when people need to quarantine or isolate. So let's walk through some scenarios so we can all be on the same page with what needs to happen if you're feeling sick or if you've had contact with someone who has the virus. Let's talk about if you're feeling ill. The best way to get a test is through your healthcare provider if you have one. That way you can be seen as soon as possible, evaluated, tested for COVID if you need testing for COVID, and also evaluated for other reasons for why you're feeling ill. You can also make an appointment at one of our OptumServe sites by calling 888-634-1123, or at one of our many community testing sites by calling 707-565-4667. This may result in a slight delay in getting your test results. It might take anywhere from 3 to 4 days to get the results after your appointment at OptumServe. During that time, you should remain away from other people while you're pending your COVID test. So you can find out more information about testing by going to SoCo Emergency's testing site. Wherever you get tested, be sure to tell them that you do have symptoms. Next, of course, stay home. If you have cold symptoms such as fever, cough, sore throat, or congestion, don't leave your house except to test or get medical attention. Other COVID-19 symptoms that you should be aware of are loss of taste or smell, nausea or vomiting, and diarrhea. At home, follow the isolation protocol, which includes staying in a room alone, not sharing spaces, especially the bathroom, with other members of the family. If someone can care for you, let them make meals, but don't interact with them. If there isn't space in your home to safely isolate, or you're concerned about lost wages during the time when you're not going out and about or to work, then call 211 or contact the Cura Project for resources, and they'll determine whether you meet the criteria for further resources. Finally, stay at home until you get your test results. If you're positive, you have to isolate for 10 days after the onset of symptoms, and your symptoms have improved, including having no fever for 24 hours without fever-reducing medication. If your results are negative, stay home until you feel better and your symptoms subside. So here's some steps to take if you've had known close contact with someone who has the virus, such as a household member, friend, or coworker. Don't get tested right away unless you get symptoms. And if you get symptoms, you'll follow what we just talked about. The incubation period for the novel coronavirus is 2 to 14 days after exposure. So an early test doesn't mean that you're in the clear. So if you're asymptomatic, you can wait and get tested at the end of the quarantine period. You need to quarantine at home by keeping yourself away from other household members. Again, if there isn't a space in your home to safely quarantine, or you're concerned about your lost wages during the quarantine period, call 211 or contact the Cura Project for resources. And again, they'll determine whether you meet the criteria for further resources, or direct you to where you can go for a potential alternate care site, a hotel that you can go to where you can stay safely to isolate or quarantine. If you develop symptoms, you can assume that you have COVID-19, making it crucial that you follow the isolation protocol we discussed before. Get tested at the end of the quarantine period, somewhere around day 12, and you can get back to your normal life after day 14 or after a negative test, whichever comes first. So again, if you're a contact to a known case of someone who has COVID, you'll likely be contacted by the public health department as well as a contact, and given information, education, told to stay quarantined for 14 days, and you'll be instructed on how to get a test near the end of the quarantine period. I know that there was a lot of information. You can always visit socoemergency.org to review these details and find more resources. I also want to remind everyone that the personal information of anyone who applies for and receives county services is protected, regardless of immigration status. We always keep your information strictly confidential and will not share your status with any other agencies. We know that it's been a long road so far, and we still have much work to do. The virus isn't going away just because we're tired of it. In fact, colder weather and shorter days mean that we will have to recommit to safe practices and making good decisions. Don't assume you're okay or self-diagnose yourself with a regular cold. Even if you're not worried about getting the virus, it's critical to stop the chain of infection that could lead to serious health consequences for yourself, someone you know, or perhaps even worse, someone that you don't know in the community. I'll also take this opportunity to underline the need to get an influenza vaccine. Please call your doctor or your insurance to find out where you can get a vaccine. It's very important, especially in the time of COVID, that everybody get vaccinated for influenza, as we actually have a vaccine for influenza. And that way you'll be protecting yourself and the ones you love, as well as the community. So thank you. We now have a few minutes for questions about the community and media.
Great. Thank you, Dr. Mase. Just to remind everybody that you can leave questions in the comments area of the Facebook Live broadcast, or you can email them to us at publicaffairs@sonoma-county.org. And remind our media friends, go ahead and raise your hands, and we will call on you. Let's take a question from the public first. Dr. Mase, So Darren asks, if we remain under 8% on the equity measure and under 7% overall for test positivity for the next 2 weeks, will that allow us to move to the red tier?
Both the test positivity countywide and the test positivity in the for the health equity metric, that is the positivity in the lower quartile of the county, need to be under, I believe it's 5%. Dr. Baldwin, is it 5 or 5.2?
It's 5.2% for the health equity metric and less than 5% for the overall test positivity of the county for orange.
So we're just about there for the overall test positivity. And we're hoping that, and it is, the health equity metric test positivity will drop as we test more and more. And as soon as both those are, as Dr. Baldwin said, under 5 and under 5.2, then even if our case rate is higher and in the purple, we can go into the red tier.
Great. Another question from our viewers. Megan H. asks, Dr. Mase, can you please discuss what lasting effects of COVID that you know of for people in our country?
So there's been some reports of people who are symptomatic for far longer than just that 10 days or so. And often it's fatigue, just not feeling right, kind of more non-specific symptoms that people have that might take months to go away. Let me ask Dr. Baldwin if she wants to add anything to that response.
No, I think that really still looking at this as COVID's been evolving over the last few months, just now starting to see what the long-term effects can be. So that's being reviewed as we speak.
Thank you. Let's go to Martin Espinoza from the Press Democrat. Martin?
Hi, Dr. Mase. Hi, Paul. I have so we're again, we haven't made the metrics for going into the red tier primarily because of our high case trend per 100,000. Where are we seeing new cases? I know you have data on your dashboard that's cumulative, but in the past 2 weeks, where are we seeing our cases in terms of neighborhoods, businesses, business sectors? What's the latest trends that you're seeing?
Yeah, I think that's a good question for Kate. And I don't know, Kate, if you have updated information in the last maybe 2 or 3 weeks.
Hi. Well, we continue to see high case rates in Santa Rosa, and we in terms of looking at industries and areas where we're seeing cases increasing, healthcare, sales and service, construction are all places where we've seen some cases recently, and the dashboard is a good place to look to see where the trends are in the different zip codes across the county, and you can look at case rate by zip code going to the cases dashboard.
I do see that the Southwest Santa Rosa and Sonoma Valley are two big kind of hotspots right now for active cases, and those would be the most recent, right?
Yes.
And just one quick added thing, and that is we're also doing a lot of testing in those zip codes. So again, we're finding the cases, which is also really important to underline.
Okay. Are we seeing fewer cases now in agriculture now that that sort of we're moving into the winter months?
The agriculture cases, we're still seeing those occur. They are at lower rates than we saw previously. We do have cases though for which people don't necessarily name who their employer is though, so it's important to note that there is some data there where we don't have occupation information, and so that may skew, for agriculture as well as other categories, the true counts that we're seeing for our cases.
And lastly, Dr. Mase, from the previous question, I think that some member of the public asked with regard to our testing and our health equity measure, it sounds like we're kind of putting or we're sort of focusing on that in terms of trying to get those rates down into that orange zone so that we can move into the red. It sounds like that's kind of our strategy right now.
Well, I mean, it's not really to, specific. It's because that does also align with targeting the hardest hit groups where we want to find the cases and stop the transmission. So, and in a corollary, it's also very helpful for us to reopen because that's the way the state set it up. So that we're doing the right thing and doing testing and outreach and partnering with businesses and the financial stimulus packages and all those things to try to get people to diagnosed and through COVID. Simultaneously, we will also be decreasing our health metric positivity rate and the overall county positivity rate.
Thank you.
Another question from the public. Chelsea asks, when will a rapid test be available in Sonoma County?
Which kind of, I guess it would, well, we have rapid testing. So yeah, we're able to do CR.
I guess the question is, will it be available to the general public?
Yeah, so the recent rapid antigen testing platforms that have been approved and that we're receiving are specifically for people who are symptomatic within 1 week of symptom onset. And so, in fact, they will be used in our emergency departments, federally qualified health centers, and other places where symptomatic people are seen. Right now, there really isn't a better platform for asymptomatic people or for surveillance like we're doing with a PCR-based test. We do have a test called the Gene Expert machine that is actually quite good tests, and we have about 60 of those a week that we reserve for our first responders, healthcare workers, and other people who need test results right away.
Okay, we have a couple of questions related to the flu vaccine, and both of them are asking really, do we, if we're already wearing masks outdoors, do we really need to get the flu vaccine, is the synthesis of the questions.
Yeah, I think it's important to get the flu vaccine because even if you're wearing a mask outdoors, you still are indoors, you're not. And if your family members are out and about and doing anything, whether it's, going to the store, the grocery store, or going, outdoors somewhere for activity or something like that, still you're at risk, and you might as well get the influenza vaccine to make sure that when you do get sick, there isn't, if you get sick, that there isn't a question of whether it's COVID or the influenza or whether it's both. There have been a few cases reported already of people having both simultaneously.
Okay. I don't know if any of our media friends have any questions. Please feel free to raise your hand. I do want to call on Adam Radke, our Deputy County Counsel, who has an update for us on the school waivers situation. Adam, do you want to fill everybody in on that?
Yes. So we have notified some schools that that they are conditionally approved. I'm pulling up the list right now. And it would be conditional upon them updating their reopening guidance to include some of the supplemental information that they sent to the health department and possibly a minor edit here or there. I apologize, it's not in front of me right now. Paul, do you have that list? Oh, no, here it is.
Yeah.
So we've notified the following schools that they are conditionally approved. Again, pending them submitting a revised reopening guidance that we can forward on to the state for final approval. That would be Harvest Christian, St. Eugene's, St. Francis Solano, and Redwood Adventist School.
Great. So that brings to, I believe, 9 schools that have either been given the green light by the state or we have been recommended for approval. So,
Or that we will be as soon as they provide us with their revised reopening plan that includes the supplemental information. Then we'll forward it on with a recommendation for approval.
okay, great. Let's go back to Martin. You had a follow-up, Martin?
Yeah, I did. Dr. Mase, I'm working on a story for Sunday about a young toddler who came down with MIS-C. That's a multi-system inflammatory syndrome for children or in children. And I'm told it's very rare. This is a mom who lives in Sebastopol, 22-month-old. She got sick. She and her husband got sick, and then her young daughter got sick, but not too bad. It was very mild. I think she was just kind of lethargic, and a month later she got really sick with this syndrome. Do you know anything about it? Do you know if there are any other conditions like this or any other instances where something like this has happened in Sonoma County? And then the other question I have is, there's an idea that children are sort of not likely to become ill from coronavirus or related illnesses or syndromes. But this mom feels like she just wants to tell her story because she wants parents to know that, something like this could happen.
Sorry, I can't discuss any specific case of COVID in our county, but what you're asking is really important because I think there is an impression that, all kids do fine, they're either asymptomatic or they don't get very ill, and that it's really that we're worried about them transmitting COVID to adults that could be more vulnerable. But there have definitely been many, many case reports. In fact, I saw a publication of case series of children who had exactly what you're describing. I don't know, Dr. Baldwin, actually a pediatrician, so I'm wondering whether you have any thoughts on that.
I don't think I have too much more to add. There are cases. We have had more than one case of MIS-C in the county. As Dr. Mase said, we can't really go into the specifics. There are cases across the United States, and I do feel like there has been a big push, or people saying that kids really don't get COVID. They can absolutely get COVID-19. There's been an increasing number of cases in children across the United States over the last few months. And even though they may not get as ill, it can still, be detrimental to them as far as having to isolate and stay home and not being able to interact with others. And it can certainly be transmitted to adults in the family, and they can have severe outcomes sometimes. So it's serious. We should take it seriously, even in children. And that's it.
Dr. Baldwin, how severe is or how bad can MIS-C get in kids?
It can be severe. It can look like several different disorders requiring either steroids or some more elaborate treatments, but it could be not so severe, like maybe the case that you're mentioning. There's a wide range, but I think every case ends up in the hospital. That's something you don't want any children to have to do,
Right.
Spend time and be admitted in the hospital for anything. And so it's serious, and it can potentially have long-term effects too. They're still looking at that.
Mm-hmm.
So it's not anything to take lightly.
Yeah, I guess I misspoke. Her COVID symptoms were not severe at all, but when she came down with MIS-C, she had it was very severe. She spent 9 days at Kaiser Pediatric ICU in Oakland.
There have been cases that have been documented that the child wasn't even diagnosed, didn't know that they had COVID, but they presented to the hospital with severe symptoms like you're mentioning, and then they went ahead and did a COVID test and it was positive. So that can absolutely happen, where maybe the initial person, they didn't initially have symptoms, or they were very mild symptoms. Nobody really noticed. And then, sometime later they've got these complications, or, things that happen further down the road, and then they got tested and they were positive. So that's not out of the norm.
Thank you.
We have a question, Dr. Mase, from Melissa, and it's a good question because it's certainly on people's minds as we head into the holidays. She asks, can you discuss travel restrictions or perhaps guidelines on whether people should be traveling this holiday season? What do you think?
Yeah, thanks for that question. It's really important because I know a lot of people have plans either locally or even to, fly in the country or even internationally. I would think that you just, the risks are clear. We do have increasing COVID cases in many parts of the country. And you can take a look at the data and see some of the Midwest states have specifically been very heavily hit. And we know that when you go into an airport, you are with lots of people from all over different places, whether it's domestically or internationally. So we have actually seen and did see early on a lot of travel-related cases of COVID. So my advice would be to be really cautious with travel this holiday season, since you may be putting yourself more at risk. And especially if you have underlying medical illnesses, you feel like you're vulnerable to COVID for some other reason, I would highly advise against international travel or even domestic travel. And I don't know if Kate, if you have an idea of, especially when people were traveling, like what percentage of cases were coming from travel-related activities?
It's a smaller proportion of the cases, but I would say is about maybe 5% or so of the cases that were linked specifically to travel.
And keep in mind that that was even with travel sort of restrictions in place. So we definitely saw a decrease once really inter-county travel and stuff was all limited by the governor's order.
Thank you. It's certainly an issue that many people are talking about. And I think I'm going to end on this question, Dr. Mase, which is one that many people are, and I know it's a very general one, but Anna Marie asks, when do you think we might be able to move to the next tier? When we might be able to move out of purple? That's on a lot of people's minds.
Yeah, that is a really great question. And again, I don't think anybody has the crystal ball to say exactly when that would happen. However, I can assure you that the strategies that we're putting into place and scaling up are going to get us on the right track in the right direction. And I'm hoping that we're going to see the effects of really ramping up these different strategies we've been discussing for the past couple of weeks, as we've already started doing, but really fully ramp up all of our strategies here, and that we'll see a good effect.
Martin, did you have one more question?
Yeah, I have a follow-up to the travel question, if I can ask. So I read a story in the LA Times where some Bay Area counties, health officers are sort of kicking around the idea of possibly asking Bay Area residents to quarantine for a couple of weeks if they decide to travel outside the state or the area. We, of course, are part of the Bay Area, but we're in the purple tier. I'm wondering if you would recommend, Dr. Mase, and I will not sound flip or anything, but if you would recommend some of these other Bay Area residents in orange tiers and if they come up to Sonoma County, should they quarantine when they go back to their counties?
No, I think it's a really great question, because if we're in the purple tier, it indicates that we have widespread transmission of COVID. So if they're coming up to for tourism purposes certainly they may have a greater likelihood of being exposed to somebody with COVID. I don't know if the other Bay Area counties are going to include domestic, interstate, I mean, not interstate, within state, within Bay Area travel as a reason for quarantine. I would advise if anybody travels domestically or internationally, when they come back, that they be very careful, potentially even get a test at OptumServe if you're asymptomatic, if you're symptomatic, see your physician, and do all the things that we just discussed in the talking points from today's Facebook live stream.
Thank you, Doctor.
Okay, well, we're going to end it there. If we didn't get to your questions, we'll put it in our database and we will get to it next week. We just want to remind everybody that next week, Wednesday, is Veterans Day, and we will not be having our update on that day, but we'll be looking to reschedule it on that Thursday, November 12th at our usual time. And we will be putting out a notice about that. So look for messaging on that on our social media posts. So anyway, with that, we'll say good afternoon and thank you, Dr. Mase, for being here, and everybody. Thank you all. Have a good day.
Thank you.